Chandler Bing is one of my favorite television sitcom characters. Chandler Bing, of course, is from the hit situational comedy series from America, Friends. The character Chandler Bing was, of course, played by the late actor Matthew Perry. Chandler Bing also denotes two aspects of the ENT curriculum that I want to talk about. And entertainment and ENT are not separated by a wide margin because entertainment begins with ENT and also ends with ENT. Let's get into the meat of the discussion. In ENT, both Chandler exists as well as Bing. Chandler exists as the classification, Chandler's classification for infection spreading to the orbit, that is the eye socket. And Bing test is one of the hearing tests that we can perform using a tuning fork to assess hearing. In this video, we are going to talk about Chandler classification and Bing test, Chandler Bing in ENT. So Chandler's classification is quite simple. It is important when there is orbital infection, which can be spread from paranasal sinuses or arising de novo. But mostly in ENT, we are concerned about orbital infections that are complications of paranasal sinus infections. Now, orbital infections can be of two types. It can be cellulitis. It can also be abscess. In Chandler classification, we have five categories or five stages, stage 1 to stage 5. The first two stages talk about cellulitis. Third and fourth stages talk about abscess. And the fifth stage is cavernous sinus thrombosis. So let's talk about them one by one. Stage 1 in Chandler's classification, I beg your pardon, is preseptal cellulitis. Now, preseptal means it has not invaded the septum of the eyeball. Septum is the anterior soft tissue boundary of the eyeball. So if the cellulitis is kept anterior to the septum, preseptal, then it is preseptal cellulitis. That is the stage 1 of Chandler's classification. Stage 2, of course, is the septum has been breached. It will be orbital cellulitis. That is stage 2. As I said previously, stage 3 and stage 4 talk about abscesses. The first abscess is just subperiosteal abscess. That means the abscess is formed just below the periosteal lining of the bone covering the orbit. And if it has breached the orbit, then we have orbital abscess, which is stage 4. So just to repeat, stage 1 is preseptal cellulitis, stage 2 orbital cellulitis, stage 3 is subperiosteal abscess, and stage 4 is orbital abscess. And as I said previously, stage 5 is cavernous sinus thrombosis. So 1 to 5 in Chandler's classification, one last time: preseptal cellulitis, orbital cellulitis, subperiosteal abscess, orbital abscess, and cavernous sinus thrombosis. What about Bing test? Bing test can be done with the help of a 512 Hertz tuning fork. This is a bone conduction test. What we do here is we take the tuning fork, we vibrate it against the olecranon process, and we place it on the mastoid part of the temporal bone. Once the footplate of the tuning fork is placed on the mastoid part of the temporal bone, the vibrating tuning fork, then the tragus is pressed inwards to occlude the external auditory meatus. In a normally hearing person, upon pressing the tragus or upon occlusion of the external auditory meatus, sound perception increases. This also happens if the patient is suffering from sensory neural hearing loss. However, if the patient is suffering from conductive hearing loss, they can appreciate no change. So the first scenario where the patient appreciates increased hearing is called Bing positive, which can be seen in normally hearing people as well as people suffering from sensory neural hearing loss. And the second scenario when the patient does not appreciate any change in hearing on pressing the tragus is called Bing negative, and it is seen in conductive hearing loss. Why does this happen? Whenever we are pressing the tragus and occluding the external auditory meatus, we are artificially simulating a picture of conductive hearing loss. We are effectively cutting off or severely compromising the air conduction pathway of sound. Whenever the air conduction pathway of sound is compromised, there is a relative increase that the patient perceives in their own bone conduction of that ear. So if the right EAC is occluded, air conduction pathway of the right ear is compromised, and the bone conduction pathway of sound of the right ear increases relatively. The patient feels it. So if the patient is normally hearing or the patient is having a problem with the bone conduction, nothing wrong with the air conduction. Bone conduction pathology usually is sensory neural hearing loss. So if there is a bone conduction pathology, or the patient is normally hearing, every time we press the tragus, the bone conduction increases. Whether it is increasing from a normal level in normally hearing patients or from an abnormal decreased level in sensory neural hearing loss, that is not that important, but the hearing does increase because the bone conduction does increase. So that is being positive, which can be seen in situations where the patient is normally hearing as well as when patients are having sensory neural hearing loss. However, when the patient is having conductive hearing loss, the air conduction pathway of sound is already compromised. So when you are pressing the triggers, you are not adding to the compromise. You can't make a bad situation worse in case of pre-existing conductive hearing loss. So this pressure on the triggers, this occlusion of the external auditory meatus does not change the picture of hearing when it comes to the patient who already is having conductive hearing loss. He already has his external auditory meatus occluded due to the conductive hearing loss. So pressure on the triggers does not produce any change in hearing in that patient. This is being negative, which is seen in conductive hearing loss. So that's Bing test, and I talked about Chandler classification, together Chandler Bing in ENT. I hope you liked this video.